We are back to our show again, Good Morning Kuwait, moving for our interview segment. A healthy smile is often seen as a reflection of confidence and also well-being. But behind every healthy smile lies something equally important, which is healthy gums. While many people focus on their teeth, gum health is also a fundamental part of the oral care and plays a vital role in maintaining overall health. Advances in the modern dentistry have also provided innovative solutions for restoring smiles, with dental implants becoming one of the most effective and reliable treatment options available today. To help us better understand the importance of the periodontal health and the warning signs of the gum disease and the latest development in the implant industry, we are delighted to have today join us by distinguished expert in the field, our distinguished today Dr. Prashanthy Prasad, periodontist and implantologist, which will be sharing her expertise on how to protect our gum, maintaining optimal oral health, and benefit from the latest advancements in the periodontal implants treatments. Dr. Prashanthy, welcome. Today we're going to talk more about how to become a healthy gum. Hello and good morning.
Good morning. Good morning, Kuwait. Good morning, KTV. Thanks for having me here. It's a privilege to be here, sharing my knowledge as a periodontist and implantologist. Very simple ways how to keep your gums healthy. And first preference always give to save your natural teeth. And then comes dental implants to replace your missing teeth.
You're most welcome and thank you so much for joining us. We are very privileged today you are with us in the studio. How is my gum?
Healthy. Looks healthy.
Okay.
You know, there is a question, sometimes the gums looks absolutely healthy when you see at once. But as a periodontist, I always tell the patient, if you have signs of bleeding or swelling, or if you have some discharge from the gums, sometimes when you take toothpaste from the over-the-counter from a supermarket and you brush it, bleeding might stop, but do a periodontist screening. That is when you will diagnose or you will come to know whether you have an advanced gum disease.
Nice. So a healthy gum, it gives like a maintain overall for a very healthy oral health, right?
Exactly.
We can say. So it's not only the dentistry, the gums play a huge role. But sometimes we see like a common disease for gums. How can we know the symptoms, doctor?
Yes. Most of the time, the gum health is overlooked. And we see, what is this gum? Gum is just a protective layer protecting the supporting structure. Like how a house is built over a foundation, the tooth has a strong foundation like periodontium. Periodontium is with ligament, alveolar bone, cementum, and this gingiva covers like a protective barrier for the bacteria entering. Coming to your question, healthy gums starts from brushing well, of course,
okay.
But nutrition plays an important role. I always tell the patients like macronutrients, how you are aware of. Similarly, micronutrients also play an important role. Micronutrients includes vitamin D, magnesium, calcium, ferritin. Basically, vitamin D is again many of us neglect. I have heard patients saying, "Doctor, everyone are deficient in vitamin D because we stay indoors." So I tell them, why don't you be a little different? Because vitamin D can improve your immunity. And in fact, if you're going for certain advanced dental procedures like extractions or gum grafting or even bone grafting implants, vitamin D plays a major role in faster healing and also improved outcome of the treatment.
Nice. And we see also in the three boxes about how the situation you already mentioned, like a healthy gum and how to know the symptoms about it. Sometimes when we're brushing our teeth, we notice there will be a blood. Is it from the gum?
Yes. Basically, gum is just showing, it's just reflecting what is happening underneath. The initial gum disease conditions or the signs what we can see, as you said, is bleeding, sometimes bad breath and swelling, pus discharge. But it doesn't stop here. And you do a normal scaling, all the symptoms will subside for sure. And I have a patient who says, I do scaling every 6 months.
Okay.
But the patient had a deep periodontal pocket. Now what is a pocket? Pocket is space between the gum and the bone. Or the teeth. Okay, so this plaque initially is soft. You brush every day, the plaque is removed. But this plaque, when it hardens, it becomes calculus. This calculus is hard, it doesn't come out from your brushing. So it goes deepens, it deepens inside. So it's the gums gets pulled away from the tooth And this is called periodontal pocket, and this pocket depth can vary from 5 millimeter to 8 millimeter. So this is actually an alarming sign for your gum disease.
It's a good thing, like doctor, you mentioned something like a real story about one of the patients. Like even we are taking good care of ourselves, it doesn't mean like we have to be cautious also. The more you care, sometimes you have to be aware about what happened to your gum. And even this is like we call the misconception, something happening. This is like leading for misconception for some kind of disease happening to the gum, or maybe from us like a healthy gum people.
Exactly, misconceptions, to be very frank, very common in dental procedures, how patients perceive. You know, they say if you do more cleaning, my enamel will become weaker.
Okay.
And they also say, I'll tell you the difference. First and foremost, there is scaling and deep scaling. Scaling is you are removing the deposits from the outer surface of the tooth. But deep scaling is you go deeper between the gums and the teeth. So patients generally have the misconception like deep scaling is painful. Okay. But with the newer technology, with the advancements in the instrument designs and everything, we do deep scaling in office, sometimes even without anesthesia, and it is absolutely painless.
Painless. So this goes me to another topic here, doctor. We are investing, you are with us today in the studio. What is the link between a gum health and also everything about the general health? Is it like there is something linked between them?
Very good question, and there is a stronger link between the oral health and the general health. If you see the European Federation of Periodontology and the International Diabetes Federation, they have clearly stated there is a strong correlation between the diabetes and periodontal disease. And also some Cochrane studies, they have said HbA1c level can be reduced after the gum treatment. But the honest truth is, periodontal treatment alone cannot cure diabetes or any disease. It also depends on your medications, your stress level, your body weight control, your diet, if I have mentioned, then smoking cessation, access to the regular oral care and the medical checkup. All this together with the healthy gums, definitely your body is healthy.
So what is the best routine to have a healthy gum for nutritionist, and something we have to do per day?
Yes, before coming to this question, I would like to answer also, because most of the patients, they don't believe, or the people don't believe when we say there is a link between the oral health and the general health.
Sure.
You know why, how this happens? As I told you, there is a periodontal pocket. A periodontal pocket which is not treated, if it is inflamed, there is no seal between or a barrier between periodontal pocket and the rest of the body. This acts as an inflammatory burden to the bloodstream and the bacteria. It has a plethora of pathogenic bacteria. This bacteria can travel through the bloodstream to their destination, that is the target tissues and organs. That is how the inflammation, exaggerates.
That's why. So now we'll go to my topic.
Yes.
What is the best routine and the food for the healthy gum?
Best routine is definitely brushing twice. Clean your tongue as well. Use an interdental aid advised by your doctor. Everyone thinks floss is the one sort of interdental aid everyone can use. No, it is actually strictly confined to tight tooth contacts. So when you have some spaces between the teeth, there is embrasure spaces, doctors have different interdental brushes of different diameters. Okay. And you can also use oral irrigation devices. That is also better to take doctor's advice and use them. And nutrition, as I already mentioned, macronutrients, micronutrients should be included in your diet, and definitely exercises and controlling your body weight, and everything will help in a very good oral health.
Nice. And now when I will go another different topic, it's also relates to the gum, dental implants. It's like a huge role you have to combine between have a good gum, and even the people, because I know the orthodontists, you are in different kind of category in the same title. So dental implants, how is it benefits to be with a good gum?
Yes, definitely. This is actually a broader topic. We cannot confine to one. But dental implant is generally, if you ask me who is an ideal candidate, a person with a good bone quality and soft tissue health, controlled systemic health. I cannot say now free of systemic health, because most of the persons will be having one or the other diseases. But even there, when dental implant is considered, there is an absolute contraindication and relative contraindication. So still dental implants can be placed. Even when it comes to a smoking patient, we say try to quit smoking and try to reduce smoking. So this is how we go ahead with the treatment planning with the dental implants. And one of the most beautiful part of dental implant is you're not disturbing or you're not damaging the adjacent teeth, which is healthy. For example, you have a single missing tooth. We are going to just take the alveolar bone, which is lying idle, put a dental implant, wait for healing, and then give a crown, which acts more like a natural tooth.
But how long it will take?
Somewhere, for example, it depends on the bone type, and also the technique. When you place an dental implant, if you have a very good primary stability, you can give the crown at an earlier stage. And also sometimes bone will be very thin. You need to do advanced procedures like bone grafting or soft tissue grafting. Yes. We tell the patient it's better to wait for some more months, like around 3 to 4 months. Ideally 2 to 3 months. If there is no any advanced procedure, if it's a direct dental implant procedure, you can give the crown.
For sure, when you mention about the dental implants with the gum, for sure you have some certain of patients you already faced before, and you give like consultation. Can you share with us like a successful story for one of the patients, like you have from your consultation, and now we have a good teeth, especially with the dental implants? Yes.
Yes, I don't know whether I can share here, but the patient himself has shared his happiness. Patient was medically compromised. He underwent major surgeries both for the heart and kidneys, and all his teeth were losing. So we placed full upper 6 implants and lower 6 implants. Basically, he had reduced bone when it goes to the posterior part of the teeth. So we avoided all the major invasive surgeries. We tilted the implants, and the patient now almost, I guess it's 4 to 5 years. Patient is happily smiling, and he has shared his testimonial as well that he's happy, and this makes us happy as well.
So you met him like a certain of months ago, for sure, or a couple of years ago, and you see him like with his new smile. How is it feels to you, doctor?
It feels delighted, and of course we feel that the best service what we can give to the patients who is in need.
Nice. So because when you do like a dental implants, I know share like a serious case for one of the patients. Now the results for him is amazing. For sure there will be a new technologies or something for helps this kind of cases patient to be better in the best time. So what about the new technologies for the gums?
Yes, the newer technologies what we can think about right now is like artificial intelligence is a game changer both in the periodontology and implantology. Laser therapies. When it comes to bone grafting, the advancement in the biomaterials, the implant types, the bone graft materials, and even periodontology techniques, especially the advancement in the invention of the tools have greatly changed, and this has made it more minimally invasive compared to years where we had to go for advanced, like more advanced
manuals.
Yeah.
So, but this kind of tools, this kind of technology is always helping us, but it's about the good doctor consultation and a patient who is already taking all the instructions, right?
Yes, exactly.
So this even there is some kind of patients, for sure they are following everything that you told to him, but his situation is so bad. What is the golden advice you have to say to everybody?
This is a very important question, and also I would like to answer like in 3 parts. The thing is, as you said, right from the diagnosis. Yes, diagnosis is very important. We need to understand what is the root cause for the problem rather than just addressing the problem. Treat the root cause and then coming to the problem is one. And secondly, how the patient can be, he can have the legacy of the treatment for a long term is patient needs to be very, very compliant, listening to the doctor's advices. And sometimes some treatment can take more time. Those who wait gets the best, as we say. Sometimes the patients needs to wait depending on their condition. And also regarding the oral health when it comes, as a periodontist, what I would like to say now is,
in brief
is go for a regular periodontal screening once in a year, because the early signs of gum disease patient may ignore. They might just take a toothpaste and brush and it's gone for some time. So a periodontal screening is important for a medically compromised patient, and also regular visits with dentist brushing twice, take care of nutrition, health advice regarding the diet, and everything is, especially if the patient is with the physician for his health, they should also take the advice from the physician always.
Amazing. Dr. Prashanthy Prasad, periodontist and implantologist. We are so proud of you. On behalf of our show, Good Morning Kuwait, want to say thank you for accepting our invitation. We're sure we'll be here again. We'll talk more about how to make ourselves in a healthy gum. Thank you so much.
Thank you so much. It was my privilege to be here. Thank you.
You're most welcome. All thanks and appreciation to our distinguished guest, Dr. Prashanthy Prasad, periodontist and implantologist. Now let's go to this tiny break. Then we'll continue the show, Good Morning Kuwait. So please stay tuned.